legal counsel, Marc Lyons, to be here and remind us again and discuss with us the Board of Health's responsibilities and protocol. Doesn't hurt for us to be reminded what our role is as board members. So I will turn the floor over to our attorney, Marc. You may speak.
Thank you, Mr. Chairman. I think it's a good idea to at least once a year to review board responsibilities and some of the issues that individual board members come across over the year. I know you've had a long day, you've had other meetings, and I'll try to be fairly brief, but I'm going to try and cover. There we go. Does that work better? Thank you. I'll try to cover a number of things here. Board responsibilities. This Board of Health is an oversight board. It is a governing board for the Panhandle Health District. But what does that really mean? Different boards have different responsibilities and different ways of approaching them. For example, some boards are part-time, uncompensated, kind of like this board. And your responsibility is oversight. You have a fully employed executive director who's by statute, whose responsibilities are to run this district. You have staff with our full-time employees with various expertise and various other responsibilities. This board is an appointed board. Some boards are elected boards, but just to contrast these things, I went through one time and looked at responsibilities of different types of boards. Most boards, or many boards, have no operational authority. Some boards have a lot of operational authority. For example, county commissioners, they have operational responsibilities. Sewer and water district boards have a lot of operational responsibility, and there are different reasons why. Commissioners are essentially full-time employees and they run the counties. Sewer and water boards usually don't have any staff, so whoever gets on the sewer and water board has to do most of the work. So they have that responsibility. Other boards are oversight. So what does that mean? That means that you, as a board, consider the initiatives, the policies, programs that are brought before you. You discuss them, consider them, and make a decision on going forward. And you follow typically you would follow the recommendations of your chief executive, who is charged to bring these things to you. So you do that as a board. And what that means is you vote as a board and you debate it. You may vote in favor of it. You may vote against it. But once it is done, even if it passes and you didn't support it by vote, you as a board member have a responsibility to the organization to nevertheless support that decision. It's already been made. You had your discussion, so you support it. Once in a while, we hear about situations where board members go out and then they try to actively undermine the decision. That is a symptom of a dysfunctional board. So I would caution everybody, and I say this frequently, not to do that, to support what happened, even if you didn't vote for the ultimate decision. Individual trustees, and this is true for almost all oversight boards, true of all oversight boards, don't have any authority. Individual trustees have no more authority than any member of the public. You only have authority when you act as a board. So what is your authority here for the health district? Well, it's pretty broad, actually. It's also quite narrow. It's listed in the statute, and you probably have looked at that at some time or another. For example, you have, as a board, the authority and responsibility to do all things required for the public health. Now, that's extremely broad. It's extremely vague, but it's quite broad. You also explicitly have the power and the authority to locate where the office is supposed to be. Okay, pretty narrow. But the point is, you have certain listed things that you are responsible. The real question comes down to, how do you exercise that? You exercise it because you have a director that you have chosen who is by statute authorized essentially to run this organization. The director brings these things to you, you review them, you discuss them, and then you make a decision if a decision as a board is necessary. I think it's important just from a governance standpoint, and I say this to, I've been fortunate to have been legal counsel for a number of public organizations, school districts, most notably the college. And I try to be consistent in saying this. The purpose of those boards is to ensure that the mission of the organization is achieved, not day-to-day control. It's not to carry out the interests of individual board members, but to look for the interest of the organization and promote that. You are the oversight board. You are not the agenda. For this organization, the agenda is put together by the executive director, the chief executive, usually consultation with staff. They know what the problems are facing the district. They have to deal with them every day, not once a month, every day. And so they will bring these things to you for consideration. Typically they coordinate with the board chair on the agenda, but those are the things that you consider, things that are brought to you as a board. And that's how it should be. If you have your own individual things that you would like to see happen, you might bring them up, but it may not be appropriate for the agenda. For example, I have a lot of things I would like to see, but I shouldn't be able to put them on the agenda. I would expect Don to tell me no. It's not my role. My role is to give legal counsel to this organization. Your role is to consider the initiatives put in front of you and make decisions when asked to do so. So that's kind of my spiel on governance. Other things that I think are important, which I think some of are just self-evident. What does a well-functioning board do? Well-functioning board, the members contribute by discussing with each other in a positive way, even if they disagree. This board has always done that. We've had, over the years, some very contentious topics that have come before this board, but the discussions have always been civil and respectful, and decisions are made, and everybody respects the decision, even if they didn't support it. So that has been the history of this board. So you remain policy-oriented rather than operationally focused. Other things that I think are just important to review are the open meeting laws and the public record laws, because they will affect you. You will note them when you get a subject that comes before the board that the public is very interested in, or the newspapers are interested in. So comply with open meeting law here. I think many of you know that. Many of you have been commissioners or on other boards, public boards. So if you have an issue on it, bring it up. It'll get addressed before the meeting so that it's done properly. All your decisions take place in an open meeting. That's required. You don't get together amongst yourself. At least you don't get a quorum. And a quorum for this board is 4 members. You don't get together, decide things in advance, and then show up to the meeting. You've had your public meetings is a legal one. Your get-together is an illegal one. Um, Public records law, this is the one that I think trips up a lot of board members. It's simply because they don't think about it. We all email things, we all text things, and we text things that or email things that we probably wouldn't want to be on the front page of the paper. But when you are doing anything related to the health district and you're on the Board of Health, keep in mind everything that you do could be a public record. We haven't had too many lawsuits trying to extract text materials, but those have come up in the past, and I suspect that they're coming up in the future for public boards. So snarky sort of things that might be funny in text or in context, a month later is not going to look funny to other people that are looking at it. Emails back and forth. My rule is always never write and send an email that you wouldn't be happy having it plastered on the front page of the paper or spread across social media, because depending on what it is, that's exactly what could happen. So those are just reminders. If you have questions about anything in specific, feel free to ask it. And if you think of something later and you just want to call me, I don't charge the health district for that. It's just something you got a question about, public records issue or open meeting issue. I've dealt with those for 20 plus years. So if you ask me, I'll just give you my thoughts. I call it pro bono. So I wanted to just do this very quick refresher. I don't want to take more of your time, but it's important to remember what you are. You're an oversight board. That's the proverbial 30,000 foot review.